Alzheimer disease, which we popularly call AD. Now, Alzheimer disease, by my introduction, it's a complex neurodegenerative disease, meaning it has a lot to do with the brain. And then when the brain function start going decline, the down part. And it's characterized by progressive cognitive decline and memory loss. And the pathophysiology involves multiple interconnected mechanisms. Now you can imagine all of a sudden, your loved ones, you can't see them again. Okay, all of a sudden you can't see your loved ones again. And not that you can't see them, you see them, but you can't recognize them as your loved one. You can imagine a husband or a wife seeing their partner and then referring to that person as another person, not somebody you have lived with over years. You can imagine what happens when a father will no longer recognize his child. You see the child as another person because you've forgotten, you've lost your memory that this is my child. You can't even remember what has happened 5 years ago. Even what has happened a few minutes ago, you may have forgotten. So it's such a very, very situation that is of public health concern. So in marking the awareness, if we look at the slide I did, it's fortunate that the slide didn't go fly. It was a purple background, and that purple background was actually carefully selected for the topic because the color purple actually represents Alzheimer disease. The Association of Alzheimer came together to come up with that color to represent that particular disease. If you look at it, it's a mixture of red and blue. When you mix red and blue, what you get is purple. And what does that purple depict? It actually depicts royalty and dignity that people who have association with Alzheimer should be taken as people who are royal, who have dignity. You understand? People who have wisdom, people who are of qualities. And again, memory and mourning is also a culture for purple, which represents memory and mourning, making it a fitting choice for a condition that primarily, affects memory and the cognition. It also stands for hope and solidarity, especially for those fighting this particular disease, and then those who are also taking care of them, the caregivers also. Now, having said that, we'll just quickly go to the pathological feature of Alzheimer disease. So when I say AD, you know what I mean, Alzheimer disease I'm referring to. Now, one of the major issues that normally happens or that was found out was that there is always a beta amyloid plaque in the brain. A beta amyloid plaque in the brain. Now, the beta amyloid plaque in the brain shows accumulation of peptides in the brain, which leads to a neuronal damage and inflammation. This accumulation of plaques leads to damage of the neurons in the brain, and then again, there's neurofibrillary tangles. There's entanglement in the aggregation of proteins right within the neurons, and as such, disrupting the cellular function and leading to the cell's death. The synapse loss and neuronal degeneration also occur, which leads to loss of synapse and degeneration, particularly in the hippocampus and the temporal cortex of the brain, which contribute to cognitive decline. Now, we can quickly just go through the underlying mechanism, I made mention of the amyloid cascade hypothesis. Now, the beta amyloid accumulation triggers a cascade of events, including the tau phosphorylation, inflammation, and neuronal damage. Then there's abnormal protein aggregation and phosphorylation. Phosphorylation means addition of phosphorus in a particular, it's called phosphorylation, leading to microtubules destabilization and the neuronal damage. So when I mention neuronal, what I'm simply saying is the neurons that runs in the brain. And there's also inflammation and oxidative stress. So activation of immune cells and release of pro-inflammatory cytokines contribute to neuronal damage and disease progression. Again, let's just quickly look at the epidemiology of this AD, the epidemiology of AD. Okay, the Alzheimer's disease is a major public health concern affecting millions worldwide. Now, here are an overview of the epidemiology. The prevalence, a global prevalence, we have estimated 55 million people living with dementia. Now, out of these 55 people living with dementia, with the AD disease accounting for 60 to 80% of them. So of people who are living with dementia, about 60 to 80% of them are actually down with AD. So we also have age-specific prevalence. And in age-specific prevalence, you have to find out that the prevalence doubles in 5 years after one gets to 55, 65. Now, the prevalence doubles in every 5 years. So from 65, before you get to 70, the prevalence has doubled. Before you get to 75, the prevalence has doubled. Before you get to 80, the prevalence has doubled. And let's look at the incidence also. The incident, the annual incident, that's the yearly incidence, is to be 10 million new cases of dementia worldwide in each year. And then age-specific incidence, the incidence increases exponentially with age, with the majority of cases concerning this occurring in those of over 65 years old. Then we can quickly just look at the risk factors. The risk factors, on the risk factors, we have age. The greatest risk factor with most cases occurring is age after 65 and above. Young ones may not experience this problem, but as you advance in age, 60, 65, you begin to see some of our elderly ones experiencing loss of memory and decline in cognitive function. Family history, once it's detected in the family, then there's higher risk for others who are members of that family to likely have such AD as a problem. It could also be of that of genetic. Then the genetic issue now, a specific genetic mutation can actually occur and lead to a risk in developing AD. And then comorbidity. There could be a condition where other ailments like hypertension, like diabetes, and cardiovascular disease can also increase the risk of one being exposed to Alzheimer's disease. So let us look at the signs and symptoms of Alzheimer's disease. There's what we call the early symptoms, there's what we call the moderate stage symptoms, and there's what we call the late stage symptoms. Let's quickly look at the early stage symptoms. One is memory loss, especially forgetting recent events, forgetting recent conversation or recent appointment. You forget. That is a sign. Two, confusion. Now, difficult understanding time, the place where you are, or situation of things. Communication. When you now begin to struggle to find the right words or following a particular conversation well, then your mood change can also be a factor in which becoming easily agitated, you are anxious, or you are easily depressed, or even personality change. Now, under personality change, you find out that there could be withdrawal, you always suspicious of anything, you having apathy, So all that are, when you notice all those things in our elderly ones, it's an early sign that this person may begin to have risk of developing Alzheimer's disease. Then there's moderate stage symptoms, which include increased memory loss. Now, there will be an increase in memory loss. The frequency of forgetting things will be more rampant. All right. For example, birthday. You can imagine someone who has never forgot his birthday before, all of a sudden, you'll be the one reminded, today is your birthday. Say, it's today my birthday. I didn't even know, I've forgotten. Then disorientation can set out, and then which will make things difficult to recognize familiar places or people. Daily task challenge, struggling with daily tasks such as how to bathe, like dressing up, or managing finances becomes an issue. Behavioral change. A typical example of such is agitation, aggression, or wandering. You see the person walking around with no aim. Then there could be sleep disturbance, difficulty sleeping, or the person will start experiencing disrupted sleep patterns. And then when this happens, we say they are on the moderate stage symptoms. There's also the last stage symptoms, which include severe memory loss, loss of motor functions, and then communication challenge, increase in dependency. Now, you can no longer be able to do certain things on your own. You have to completely depend on whoever is around of you to take care of you. For example, if you want to eat, they have to support you to eat. If you want to go and take your bed, they have to take you to bed. Anything you want to do that ordinarily you do on your own, now you need an aid to do them. Then vulnerability to infection, and at that point, there will be an increased risk of infection, such as atypical pneumonia. Now, having said this, there are other symptoms that can also come with, this, such as hallucination, whereby seeing or hearing things that are not there. You can hear things that are not real, they're not there. There could be delusion, where you start believing things that are not true. You start believing things that are not true. Then there could be paranoia. Then you're feeling suspicious or mistrustful. People you ordinarily trust before, now anything they do, you suspect them. You don't longer all of a sudden. Then there will be change of appetites, whereby the eating habit now or their weight will change drastically. So those are the things that we look at. Then the question now is, how can we diagnose Alzheimer's disease? How can we diagnose Alzheimer's disease? Now, diagnosis of AD involves a comprehensive evaluation of cognitive, behavioral, and physical symptoms. So let's quickly look at an overview of what we will do. There's medical history and physical examination that must be done. So under medical history, then details of this is by assessing the symptoms, and then medical condition, and then medication that the person is probably taking. Then for physical examination, you evaluate over and the potential underlying the conditions that the patient is having. And then we have cognitive and neuropsychological tests. Now here, memory test is conducted, and then you assess the person's short-term and long-term memory. How well can this person remember something that has happened 5 years ago, 10 years ago? How well can this person remember something that just happened yesterday or just something that just happened today? So long-term, short-term memory is evaluated. Language and communication test. Here we evaluate the language skill and the communication skill of the person. Has it changed compared to what it used to be before? Then problem solving and judgment test. How can this person solve an ordinary day-to-day problem? What is the judgmental acute? You assess that, and then all this will help the doctor to, say, okay, this person may be experiencing or going through AD as a problem. But there are other biomarkers or investigation that can be conducted to also ascertain and then confirm the doctor's suspicion, such as beta amyloid biomarker.
Dr. Victor, sorry, sir.
Yeah, I can hear you.
Can you see my screen now?
Me? Yeah, I can see your screen.
Good.
I can see your screen, yes.
Okay, go ahead, sir.
All right. So the biomarker and imaging. We have one, the amyloid biomarkers. Here you are trying to measure the amount of beta amyloid level in the cerebrospinal fluid using amyloid PET scan. The patient can also be made to go through tau biomarkers, whereby we are measuring the protein level in the CSF, cerebrospinal fluid. Then we can also ask the patient to go for MRI scan or CT scan, whereby we can evaluate the brain structure and then the ruling out other conditions. And then the patient may be made to go through PET scan, whereby we assess the brain's metabolism and beta amyloid deposits. What are the treatment methods? Now, in treatment method, we look at the pharmacological treatment method. When I say pharmacological, that means drugs, orthodox drugs that we can actually, use to help the patient. They are the class of cholinesterase inhibitors, such as donepezil, rivastigmine, and then galantamine. All these I have just mentioned will only help to improve cognition function by increasing the acetylcholine level. Then we also have the NMDA receptor, relates the glutamate activity and helping to slow the disease progression. Then we can also do a combination therapy. Here we are not combining the cholinesterase inhibitor and then the NMDA receptor antagonist to get an improved outcome. All right. Now, having said so, we have the non-pharmacological intervention also, like cognitive stimulation therapy, reality orientation therapy, exercise and physical activity, cognitive training. But I want to dwell on the emerging therapies, which we need to focus on and look at. For example, the beta amyloid targeting treatments. Then we look at the tau targeting therapy, where we have the likes for beta amyloid targeting treatment. We have the likes of lecanemab. All this will help to slow down cognitive decline and then remove amyloid beta plaque from the brain. Then we have also when we use semironamide, which will help the anti-tau immunotherapy, aims to reduce the protein accumulation in the brain. Then there's gene therapy, which targets the specific genetic risk factor, such as the APOE4, to modify disease progression. And there is stem cell therapy, which is on the frontier of Alzheimer treatment. There's a whole lot of research going on regarding the stem therapy, and with the clinical trial that's ongoing, there has been a whole lot of positive results in that area. And no wonder when we use phytoscience double stem cell or crystal cell for treatments, we are getting results when it has to do with AD. The other trials that have been done are on embryonic stem cell and adult stem cell, and other stem cells, just to make sure that the safety is okay and also their efficacy also. But so far, so good. All done have gotten a positive result regarding in the treatment of this. Just that is still very much ongoing to rule out safety before it will be commercialized. Now, in conclusion, why this remains a significant challenge, advance in research and treatment offer hope for improving the lives of those affected. By working together, we can actually make a difference in the fight against Alzheimer's disease. Thank you very much.
Wow. Wow. Can we give a reaction, full screen reaction to Dr. Victor? Sir, thank you very, very much.
Yeah,
Let's
you're
full
welcome.
the screen with reaction. Let's full the screen with reaction. If you appreciate this information tonight, I want you to full the screen with reaction. Thank you so much, sir. Thank you so much. I've learned so much tonight. Sincerely speaking, I was just looking at when you are saying all this. I was looking because I had a patient with such condition, and they went through several treatment procedure, and when they started the stem cell therapy, and it was awesome, and it was amazing. Believe you me, because after so many years of that condition, they actually finally get a result. So, Dr. Victor, I know a lot of people may have a lot of questions here, and I've been taking down some questions here, sir. And I don't know, maybe I should take those questions first, then we can proceed from other questions that will be coming in from the. So don't go yet to people. Stay put, because there are a lot of information you are going to go home with here tonight, because we are still going to showcase to you other solutions to these conditions very, very soon. So, Dr. Victor, the first question I saw here, somebody wrote, he said, can Alzheimer's disease be prevented? And I know in the course of your presentation, you've talked so many things about how it can be prevented. So I think I want to get clarity about, say, if it can be prevented. So should I take all the sir?
Yes, let's take it all. Let me see all your questions so that I can know what to do.
Okay. The second question is, how can conjunctive support to loved ones with Alzheimer's disease? Then the third question is, what is the progressive for with that Alzheimer's disease? And the fourth question was, how are there any developments of Alzheimer's disease research?
Okay. Can you hear me?
Good, sir.
Can you hear me?
Dr. Victor, are you there?
Yeah, I'm here. Can you hear me?
Yes.
I can hear you. Can you hear me?
Yes, I can hear you now.
Okay. Let me just.
Question, sir.
Yeah, I had your questions. I had the questions.
Okay.
I think the first question we're talking about, you are asking if can Alzheimer's disease be prevented. The truth of the matter is why there's no guarantee way to prevent Alzheimer's, but lifestyle, healthy diet, social engagement, and cognitive stimulation may reduce the risk. So there's nothing like, oh, I want to. The thing is, your modification of diets, then your regular exercise, your social engagement, and cognitive stimulation may reduce the risk. So we need to keep tasking the brain. Let us not relent. The brain is a powerful organ of the body that can do so many things for us. So we can try as much as possible to engage in new things, learn more new things every day. It will help, but there's no sure say, okay, once you can actually prevent it, and once you are not doing all these things and it runs in the family, the risk of having it might be very, very high. Then the second question you asked is, you said, how can a caregiver support loved ones that has Alzheimer? Yeah, what is expected of them? Because the caregiving is also very, very important, and it provides emotional support. It's very, very key, and for them. Uh-huh. So, and again, helping them with their daily task is also very, very important, and encourage them social engagement. Is also very, very, very key, and also seek support for themselves. Let them seek support for themselves. They should not, keep to themselves alone. They should allow people to assist them, people around to assist them well. Then I think one of the question asked is, are there any new development in Alzheimer research? Yes, of course. Like I said, there was a whole lot of research ongoing, and then we are exploring new treatment options, which includes some of the things I mentioned earlier on, like the amyloid targeting therapy, then the tau targeting therapy, lifestyle intervention is very key, and also the stem cell therapy treatment is also there. Then I think the fourth question we asked is, what is that again? You asked,
so what are the
what's the prognosis for someone with Alzheimer's disease?
What are the
prognosis
for someone with Alzheimer's disease?
Yeah, prognosis. Alzheimer's disease is a progressive and symptom worsen over time if not taken care of. But with proper care and support, individual can actually maintain a quality of life. Yeah, with proper care and and then support, individual with Alzheimer can actually maintain a quality of life. So yeah, prognosis, it could be worse when there is no any care at all. Yeah, I think those are the few questions you asked. I hope I was able to.
Okay, thank you very much. Yes, you have done justice. I believe a lot of people are also learning from it. One other question that somebody just sent, I saw there is this. It said, if this condition associated to age people, like people that fall within that 50 and above, is it also concern to look at for people with not up to that age? Is it possible for people up not to that age having that condition?
It's a little bit rare, but one thing I will advise is once you begin to see it occur in a family at that age, now you that is at 50, and then you need to, do everything possible, your lifestyle, your exercise, your diet, and so many other things that you need to do to make sure that you help yourself to prevent it occurring or getting to you. Because once you begin to see it in the family, you are more at a risk in developing it. So one of the reasons why you see that some people in the family have one particular ailment and others don't have it is because those ones have chosen to live in a certain way. Especially, let's use the word healthy to prevent all those other things. Since it's it can run in the gene. So that's that.
All right, thank you very much, Dr. Victor.
Yeah.
In fact, I'm enjoying this this conversation tonight. It's amazing. When we started, I said, what you don't know is bigger than you. And sincerely speaking, I want to really appreciate you for coming out with this amazing information for us. And somebody said, is this condition like Parkinson? That's what the person is asking. I saw it
Like
in the
what?
group. Say, is this condition Parkinson disease?
Okay, PD. Okay, yeah, it's not like Parkinson disease. I think Parkinson might, depending on the angle you are looking at it, Parkinson might seem to be the worst, and this one might seem to be the worst. So now, most of the things you experience in Alzheimer might be experienced in Parkinson. But as someone who have an Alzheimer, you might not experience tremor. You understand? You might not, the issue of nerve coordinations and the motor neurons movements might not be a bigger issue, but in Parkinson, movement is serious. It might be a serious challenge. Both of them are actually issue with the brain, but are caused by two different things. We're talking about beta amyloid protein. We're also talking about dopamine, producing cells in the brain. That's for the Parkinson, So there are two different things, which, for example, now, why I would say Alzheimer might seem so serious. All of a sudden, people you are used to, people family, you don't know them anymore. It could be painful. It could really be very, very painful. Both of them are progressive, both of them are ahead. So, and then for Parkinson, yeah, you might begin to experience loss of memory as part of it. Hallucination can occur in either of them. So, but they are not really the same, but they have to do with the neurodegenerative. They are both neurodegenerative disease, and they have to do with the brain, but of different factors that causes them. And they present, their symptoms are quite different.
Thank you very much, sir.
Yeah.
Thank you very much, sir, for that explanation. We are going to still take some questions, but before we take those questions, I know Dr. Victor will be here, so just be patient with us. We want to show you one of the treatment patterns that Dr. Victor talked about. We are going to show you here right now so that you can understand better what we are trying to say here. So we are showing you here the stem cell therapy, and that is why you have to leave one of the remedies that Dr. Victor talked about is your lifestyle. If you know it runs in the family and you choose to stay away and live a better life, you discover what happens to you. It means that you are going to enjoy a better life without you having that same condition that is happening in the family. So how do you do that? It's for you to get back to nature, which is the stem cell therapy, where we are not made up of drugs. We are all made up of cells. That is what we are made up of here. So I believe we can see my slide. And what is this stem cell all about? The stem cell therapy is a mother cell, which has the ability to produce normal cell. Now, one main characteristic of this is the ability to self-renew itself while maintaining the potential to develop into other types of cells. Now, if you look at the condition we are talking about today, you discover that is cell degeneration. It's when the cells of the brain is dying. Now, but what stem cell will come and do for you? It helps to rebuild those cells. That's why stem cell has the ability to take care of so many health conditions, because from the cells, the human being is made. The cells makes up tissue, the tissue makes up the organs makes up the system. Now, going to fall short, that something is wrong somewhere. It means that is the cell that is beginning to damage or is redundant. So what do you need to do? Is to go back to where you are from, which is a cell. You see that now. Now, stem cell has its own way. Our body has different cells. Cells can differentiate cells, muscle cells, lung cells, tissue cells, kidney cells in every part of our body. Even including the brain has its own cell. Your nails has its own cell. The hair has its own cell. So it means that every cell has its own function. So what you need to do is to rebuild those cells you are losing. Because once you are 0 to 12 years old, cells begin to multiply. But once you leave that stage, you go to the 6th stage of life or the tired stage of life, the cells are running out already. So, and if you don't give the body back those cells that's running out, it will ask for it when you get to the 6th stage of life. So the reason why you even need the stem cell more, it's not because you are sick, but because for you not to be sick. Everybody has stem cell. Everybody uses stem cells on a what? Nourish ourselves, bringing back ourselves to its normal functionality. And if you do that, your body will be healthy. That is why you can see what's the potential use of stem cell, what it can give to you, including the condition we are talking about today, Alzheimer disease. Is there? The Parkinson's disease you are talking about, any condition that has to do with the brain. Stem cell therapy takes care of it. And beyond that, over 200. So let me appreciate and show to you this evening the revolutionary plant stem cell therapy that has been helping people in the society today to know to fight and combat several health conditions today. Now, let's look at the product we are talking about today. We are talking about the double stem cell and the crystal cell that can take care of so many health conditions. Their work is to regenerate, activate, bringing back the cells to its normal functionality. Now, what this product will do for you is amazing. You can look at, it takes care of over 200 medical life-threatening diseases. You can see so many here on your screen. So let's move on. How do you take it? This is what makes it different from drug or the supplement. The consumption rate is what we call, the application rate is sublingual, which is underneath the tongue. It goes directly to the bloodstream, down to the cellular level, works from the cells to the system. That's what makes it awesome and amazing. And it's a new discovery in the field of medicine. Let's move on. The next product is a Snowfie Forte. The Snowfie Forte is antiviral, it's antifungal, it's antibacterial. It's a chlorophyll-based product that helps you to detoxify every heavy metal toxins in your system. For anybody, everybody that is on this call tonight, everybody needs it, because all of us, we are prone to all these things we are talking about. So the food we eat, the water you drink, the air you breathe in, all these things are what? Contaminated. But what do you need to do? It is important for you at least to detoxify your system. Clean your system, clean your bloodstream. That is what Snowfie Forte will do for you. I call it CBN, which is it cleans your blood, neutralizes free radicals, and it boosts your blood count. You can see who can take it. Everybody on this call tonight needs to take the Snowfie Forte. Then we have the Actual Plus that is made up of 18 fruit, 12 vegetables, and 9 spices. It's not drugs, but works excellently more than the drug. This is an amazing product that everybody needs to have at home. It boosts your immunity. Remember, if your immunity is strong enough, there's tendency you can fight any health condition. So it means that you need to stay on this therapy of this Actual Plus. I call it finisher because I have tested it, I have tried it on people, and it has been an amazing time. So how do you take it? Just take it, you take it 2 hours after your meal, and you take 10 drops 3 times daily. If you are using it for recovery purposes, that is for any health condition. But if you are using it for maintenance, you just take 5 drops 3 times daily. We also have the skin-related condition therapy. So we have the eye and bone condition also, which is the Eye IQ Plus. That's either you are a child, either you are an adult, you need it, because treatment we're talking about today You see, one of the risk factor, this memory loss, this IIQ plus, if you're already in that position, these are the products you need. Because sometimes you hold your car key and you are looking for that car key. You want the kitchen. The next thing you get to the kitchen, you don't know what you are there to do. So you forget things easily. Sometimes you are working, some persons will be talking to themselves. All these things, we're seeing them happening right in our front. We are seeing them happening. So you have a solution to this condition. Phytoscience has taken it upon themselves to come out to help people to achieve it. We are saving lives and helping people to achieve their also weight management. For those who also want to lose weight, this is the place to be. We have the new Fort and the new lights that can help you to do that. All our products are certified by NAFDAC. Also, it's international certified, which is FDA. We have the GMP. We have the vegetarian, it's 100% natural. It's halal certified ecology. So it means that what we are talking about today is a new medicine called the product liability insurance. We have several testimonies about this product. But I will advise you, if you cannot look at it, take your eyes off it. But what we are concerned about today, we are talking about Alzheimer disease. And we have stem cell therapy that can help you get back to that solution that you are looking for. You have so many persons out there who are looking for solution for this condition. Please let them know today that there are stem cell therapy from Phytoscience that can help them take care of this condition. There are other treatments that Dr. Victor has also mentioned here. We have, like I said, I have a testimony of somebody who had that condition for over 15 years. They have been managing it until they came across Phytoscience therapy about 3 years ago. The man till today is now okay. And it has been an awesome time, and the man has been introducing it to other people because they have association based on that condition. So we want to thank you for staying by, and you just get back to the person who refer you here, and you discover what happened. The person will give you more information about what we do here in Phytoscience. So let's get back to the person who refer us here, and the person will show us. So Dr. Victor, right. We are back to you. Let's check my co-host. If you have questions on the chat room, can you read it out for us so that we take, because our presentation is time bound, and to take maybe 2 or 3 questions, and we'll call it a day. My co-host, any question in the chat room, you can look through and you can read the question out, please. And if you have any question, you can raise your hand. If you have any question, you can raise your hand. We are going to take the question.
Good evening. I'm trying to locate the question I had here, but I think maybe my network must have gone off at some point. Someone had asked if taking snowfield fort and crystal cell, especially after you've explained this, early in life would prevent the onset of AD. And then the second one I asked is, are there certain drugs or medications that people take that can increase the chances of one getting AD?
All right, Dr. Victor.
All right, so okay. So yeah, like as you rightly asked, about if taking crystal cell and other Phytoscience products, if for any reason you suspect, maybe not just suspect, maybe there is someone in the family, grandmother or grandparents or someone, a relative has this issue, yes, not only will you do crystal cell or double stem cell or snowy forts, remember one of the most important in this area now is the IIQ. So that because the problem actually has to do with the brain, and then all those oxidations taking place in the neural cells, or the plaque that are being formed in the brain cells can be actually be removed. You understand? So, and then the brain is protected, nothing will cause any issue at the long run. That's the perfect way to prevent this. But again, another thing is you don't even have to wait until one or two or any other person from your family has it. On your own, you can do maintenance where you are actually using it to protect unforeseen issues that has to come with the problem. Yeah, as for the other question, which says, is there anything, any medication that one is taking that can cause the Alzheimer issue? Anything that can affect the beta amyloid of the cell, of the brain cells, and that can make it to cause a plaque there, can actually lead to this problem. So you don't assume there's any specific food or medication, but a whole lot happens in the brain. There's a whole mechanism, processes that is taking place in the brain. We just, say it that way. That's especially oxidations that are occurring in cells and then in the brain. All that can lead to that. So gene can lead to it, most especially. Then I think that's pretty it. So it will be better if to prevent, you live a lifestyle such that is healthy. Exercise, avoid especially too much of sugar, especially refined sugar. All those things are not going to be good, especially for the brain. Then fatty foods, too much of fatty food. When I say fatty food now, we're talking about hydrogenated fats. Fats from a natural source, they are good for the brain because the brain itself needs, fats to function. So those are the things. Thank you.
Thank you very much, Dr. Victor.
Yeah.
We appreciate you, sir. Back to the person who will refer you here, and you discover that Dr. Victor will also take your question out if you have questions. So let's take one more question from the chat room, or if you have a question, you can raise your hand, just one, and we'll call it because our presentation is time bound and we are already out of the time. So my co-host, any question in the group, just one, we'll take it and we'll close for the day, please. One more question and we'll close. Okay, let me check if there's any question. Okay. If the question is not relevant to what we're discussing today, you can get back to the person who referred you, and you can channel the question to, and we are going to take them. I think we have exhausted these questions here. All right, in absence of no question, once again, let's show reaction to Dr. Victor. Let's appreciate him. Sir, we want to thank you. We want to appreciate you for your time. We really appreciate this information tonight. I want to thank Phytoscience for this great opportunity. Every